part of my job is to help women be heart healthy, but also just to bring awareness to the fact that heart disease kills women and how do we prevent it, and to be on the preventative forefront.
Hi, I'm Nina Goodheart, and welcome to Untapped. Today we have a very special guest with us, Lindsey Bomgren, a certified trainer, fitness instructor, mom of 3, and the mastermind behind Nourish Move Love. Lindsey, thanks so much for joining us.
Thanks for having me. I'm excited to be here.
And with that, it's time to ask, what the health? So let's dive in. Lindsey, you've been open about this. Your mother's diagnosis with hypertrophic cardiomyopathy shaped your passion for women's health. Can you share how this experience influenced your advocacy? What challenges did you and your family face?
Yeah, I mean, I've always loved health and fitness and women's health specifically. But in 2017, my mom went into sudden cardiac arrest on my kitchen floor and I had to do CPR. We're very fortunate. She is a small portion of the survivors that actually survive outside the hospital setting. And so very grateful for that. But that just like really opened up to me women's heart health in general, and like how big, I didn't know heart disease was the #1 killer of women. And that experience really unveiled all of that for me. And so I learned a lot through my mom's experience.
You know, it's always amazing to me that women don't know that heart disease is the #1 killer of women. We think about breast cancer and ovarian cancer, all really important things to understand. But most women will have a cardiovascular issue before they suffer from anything else. And having them understand what those symptoms are and how to advocate for themselves, I think is just going to be critically important. Just wondering how you think about that and how you do that.
Yeah, I mean, I think the problem is that the symptoms are so similar to just like women in general bear a heavy mental load, working moms, they're trying to care for their family, they're caring for possibly their parents. So they're in this like sandwich generation, and caring for themselves just feels A, an afterthought, but B, the symptoms are fatigue, right? Breathlessness, things that like, I'm stressed, I'm tired, I'm overworked. It's just written off. Like I'm stressed out in this season, you know, or maybe I'm struggling to get up the stairs without, and I'm getting out of breath. I haven't worked out in a long time. I'm gaining weight. I'm getting older. Like these are just things that just happen, and they're happening. And so that's not really worth talking about or talking to a provider about, and just brushed under the table until something serious happens. And so I think that it's just really important to know your family health history because of that.
I think it's so important, exactly what you just said, that women have to understand their own bodies, right? You know when something is off, when you're not feeling right. And I think that's especially true for women as they get older.
I fortunately have had the privilege to interview some doctors through my platform. And it was so interesting to me. I recently interviewed a doctor, and we know that the heart health symptoms specifically are like exacerbated during pregnancy and as we head into menopause. Those hormonal changes and those hormonal shifts can like bring a heart issue to the forefront. And I was like, if you could just tell every woman one thing, like what would that one thing be that they should be doing or looking out for or monitoring? And it was so simple, and something I'd never heard before, but it was simple as getting a blood pressure cuff and taking your blood pressure on a daily basis and having a baseline. And that is the easiest, simplest way to know if something is wrong. And I'm like, what a practical tool that we're not using.
So a lot of times when we talk about women's health, we talk about the fact that women's symptoms are often dismissed. They go to the doctor. If they're getting older, they're told, well, you're aging. This is normal. Shortness of breath is not that big a deal. We'll watch and wait. How do you think about helping women understand what those symptoms are and what they can actually do to advocate for themselves?
Yeah, I think it's similar to anything you want to improve in life, I think you should track. So I'm a trainer. And so when people say, I want to increase my weights or I want to get to 10 push-ups, I'm like, okay, let's track where you're at. How many are you getting right now? What's the weights you're using? How many reps are you getting, right? And the only way to track our progress is to measure it. And so I think this applies in this situation. I think women will show up to the doctor and feel, oh, they'll just brush it off or shrug it off. I mean, to be frank, you would learn much more about my health if you talked to my husband than you would me. He would be like, listen, she's waking up at 3 a.m. She's, running on hyperdrive all the time. Her brain doesn't shut off. Like he would tell you much more than I would tell you. I'm like, I'm fine. Everything's great. So, but for women specifically is to track your symptoms. And so I'm waking up at 3 a.m. every night. That feels off to me. Or I'm experiencing breathlessness every time I go for a mile run. That didn't used to happen to me. And like truly write it down, track it. And so when you show up to your doctor or your provider's appointment, you have something to give them and go off of. And it's like, no, I've been tracking this. This has been going on for weeks. We're not dismissing this. I think that's so important, is to track your symptoms.
And do you talk about that with your friends, with your family?
It's something that we talk about more now. And it's still like, I'll ask my mom, how are you doing? Oh, great, fine. And my dad's like, no, she was an AFib last week. It's the same thing. I learn more when I talk to my dad than I do when I talk to my mom.
It's interesting. Medtronic ran a campaign called Letter to My Mother. And the whole goal was to have families talk about women's heart health amongst themselves and have daughters talk to their mothers, to have children talk to their grandmothers. And what we found, it was so interesting, what we found is women don't like to talk about their own health. They will talk about religion, they'll talk about politics, they'll talk about the rest of their family, but they get very uncomfortable when they have to talk about themselves. And I think we've been so trained as women to take care of everyone else that we forget to take care of ourselves. And what we also forget is if we don't take care of ourselves, we can't then take care of anybody else. Okay, so let's mix it up a little bit and bring out the whiteboard. We call this section Heart to Heart. We'll start with this first question. What percentage of women find it hard to make their own health a priority?
Oh, I'm going to go big on this because I think it might be, but I'm going to say 80%.
Pretty close. It is about 60%, and this goes up to about 75% for women with children under the age of 18.
I feel that in my soul.
All right, you ready?
Let's go.
True or false? When it comes to serious heart concerns like heart valve failure, women between the ages of 30 and 50 are less likely to be treated with minimally invasive solutions than men.
This one's out of my ballpark. I'm going to go with true.
But you got it. Exactly right. True. 35% less likely. It's incredible that men are often treated much more aggressively when it comes to heart conditions than women.
Okay, so expand on this for me, because I feel this way just about scientific research around fitness in general, that women are not commonly part of the study, right? They're not part of the research. Is this true for in your space as well?
True. In the 1990s, we started to include women in research, but for the most part, everything we study is in men. And we've got to change that.
I could not agree more. In fact, like tech wearables that we wear, a lot of this was developed around male studies. And so I was so frustrated with my HRV, your heart rate variability. And because it's continually the 2 weeks before my cycle dropping. And they're like, that's because it's just not set up for the female.
That's right.
The female cycle. And I was like, oh, that's so frustrating.
But we have the opportunity to change that. We actually ran a trial called the SMART trial, where we very intentionally enrolled 90%, just about 90% of women. So almost the entire trial was in women so that we could study heart valves in women. And what we found is that there's a difference in terms of how one heart valve works versus another heart valve in women. And we've got to be able to do that across the entire spectrum. Okay, next one. You ready?
Yeah.
More than 2 in 5 women experience fear or anxiety about going to the doctor because they believe their symptoms won't be taken seriously. True or false?
I'm going to have to say true.
I think you should have put that in all capital letters.
We'll give it an underline.
Women don't advocate for themselves because they feel like they're going to be shut down. But if we can equip them with the signs and symptoms and the information, right, to better advocate for themselves, if they can bring somebody with them to help advocate for themselves, we're going to see women being better taken care of overall. So at Medtronic, we believe healthcare is better with tech. So let's talk tech. So Lindsey, how do you use technology and social media to empower women to take charge of their heart health?
Yeah, I mean, to be honest, my whole business is built on technology, which is just wild. I actually started back in 2015 filming workout DVDs, and man, how that has shifted. But I just think I have like this amazing privilege to share workouts with women all over the world. Through like a tiny screen and a set of dumbbells, we get to connect. And so we actually go live every other week or so. And on those live workouts will be women from South Africa to Saudi Arabia to, Europe, you name it. And it's just crazy that we all come together at this one touch point to do a live workout together. So technology has transformed the way I run my business and the way we run and how we operate and share fitness with the world.
So Lindsey, can you talk about wearable tech? I know you've talked about this quite a bit. What is that role in terms of catching emergencies before they happen?
Absolutely. I think it's incredible that a lot of us are walking around with wearable technology, tracking our heart rate, our sleep, our recovery, our stress, steps. the information is so prevalent, and I think it's really helping women specifically just be more in tune with their body and know when their heart rate is elevated and that something might feel off, and then feel like something feels off, but it actually is. I can see the data.
I think that's exactly right. What I'm loving is that we're seeing women of all ages start to incorporate this.
Yeah.
My mother now wears a wearable device, and she's tracking all of her metrics pretty carefully. And I think a couple of years ago, it was really just young people and young women, but now we're seeing women, all the way through their 80s and 90s, using this wearable tech to be able to advocate, right, for themselves.
It is incredible. I did the same thing for my mom and my brother, and now my mom can identify when she's an AFib at any point in time versus guessing. She'd be like, I feel tired, I think I'm there, but now she can literally know, and she can track those dates and bring those specific dates to her provider. And it's so much more to go off of than just a feeling. There's data to back it up.
Right, and we're also seeing people use that data, right, bring it to their physician to then determine, well, maybe tracking through a wearable's not enough. You need a cardiac implant,
Yes.
like a cardiac monitor. And we're seeing an increase in that as well as people take better care of their heart.
Absolutely. It's going to be so much more preventative healthcare happening than reactive.
I think that's exactly right. And that's a wrap on this episode of Untapped. Thanks so much for joining us. I hope you all learned something. I know I did. Thanks, Lindsey.
Thank you.